I'm Jenny Van Leeuwen. I'm a physio in private practice in Caloundra, Sunshine Coast. I've been in practice for about 10 years. Physiotherapy really is it's an evolving process. I started in kids 40 years ago, and I've gone through intensive care and mums having babies and sporting injuries, and now this is where I've found that it's my niche and I love it. I'd used the little Mediquant lasers way back early 2000s, and I really didn't ever get a great deal of joy from them, to be honest. And then I went to the lymphedema conference in Darwin in 2016, and that was where I was first introduced to MLS laser through the ASA, and I just saw it and I just loved it, and I had to get one. I use the laser on almost every single client I have because it's just such a wonderful adjunct to what I do. I've always gotten people better, but with the laser, I can get them better quicker. It's not as painful. If they prefer to have laser to acupuncture a lot of the time. And just my results are outstanding. And some of the things that I'm treating now, I would never have been able to get these results before. I've had a man in recently with a progressive muscle wasting disorder, which has not been diagnosed. He has pain every day and every night, and the sensation of cramping in his legs, which is driving him crazy. And he came to me, he was fairly negative and depressed, and maybe there's nothing you can do for me. Now, we did a series of laser on him with very, very gentle effleurage as well. And following that, he came to me and he said, for the first time, I have no cramps. And he said, even though it has not cured him, his quality of life and his function is so much better. And to me, that's joy. Now, the laser can't help to diagnose. However, the diagnosis has to be correct before using the laser. And this would be a concern to me that no one should use a laser who really isn't, be it medical, podiatry, physio, because you need those assessment skills, you need to know what's going on. The layperson off the street, it's not something you can think, oh, whoopee, I'm going to buy one of these and make a fortune. That's not how it works. My laser is not just any laser, it's Lorenzo. It's Italian, it's sleek, it's stylish. And it's cutting-edge technology, and they know it. They feel the difference, they ask for it, they tell their friends, they come in and ask for it. I use it routinely with my lymphodemas because I believe it really does enhance that lymphatic transport. Pain around the chest wall, so the laser is really helpful for the pain, to release the axillary webbing, to work on the upper limb swelling, chest wall swelling. So that, aside from that, I'm using it for musculoskeletal issues, and I've had some fantastic effects with shoulders, Achilles, the same as Bronwyn, back pain, the sciaticas, etc. It's the whole gamut of anyone who comes in, but I'm just finding it really interesting and engaging to look at the things that are different, the peripheral neuropathies, the weaknesses, that sort of thing, which is outside of the normal the normal ability for us to do anything to help. I would be saying, look, this is advanced cutting-edge technology. This is the best you can get. I looked around at the various lasers before I bought the MLS M6, and this was the easiest to use, the best to look at, the best to move, and I just feel that the technology in this laser is just amazing. So I would just say, just do it.